trainer and supervisor. Mario is international trainer and director of ALECIS, Institute for Integrative Psychotherapy and Brainspotting Spain, and the president of the Brainspotting Spanish Association. He's also an author of the very valuable book Beyond the Self, Healing Emotional Trauma and Brainspotting. Mario has been educated Slovenian psychotherapist about brainspotting method and trauma healing since 2012, and he's big supporter and mentor of brainspotting community in Slovenia. And in October this year, he will hold the professional development training on psychotherapy of trauma integration and reprocessing Alessia method. And we will give you some more information about it at the end of the webinar. And before we start to technical things, I would like to ask you that you turn off the microphones, and when you have question, you open it. And if anyone doesn't feel comfortable by being seen by others, you can switch off the camera, because as Mario already mentioned, the webinar will be recorded and you will be able to view it again. And I think that this is it from me. Mario, the word is yours.
Thank you very much, Sabina, and the rest of you, Jana, Tamara, Mina, the organizers in Slovenia. I'm very honored and glad to share again a piece of my time and my knowledge with all of you in Slovenia, but also with the ones that are coming from Slovenia, Slovakia, or Italy, or the States. So welcome to all of you. As all you know, my idea is to share with you some short ideas about these consequences of this pandemia on all of us, but on the population. And the second part of this webinar, I want to share also some guidelines about the treatment. You know, when I thought on this webinar weeks ago, I felt impacted by the strength of this pandemic in all the planet. And I feel that most of us as psychotherapists will not enough prepare to face this challenge. So I was thinking that as this is a planetary pandemic and is going to cause a huge trauma and maybe a planetary trauma, I was imagining, fantasizing that we could have a huge amount of people calling us, needing us. And this is crisis intervention, which is different from psychotherapy intervention. So the first idea with which I organized the concepts and the content of this webinar was mainly focused on providing intervention in a crisis, which is not the same as at all as psychotherapy. So I will share with you some ideas of this, also combining with a deeper psychotherapy. So I prefer, if any of you need to interrupt me and ask some question in the middle, you can do it. But anyway, we will provide some time at the end of my explanation to share and to open for your questions. So also thank you to Brainspotting Slovenia to promote brainspotting in this very nice country, which I love, Slovenia. And so many of these ideas, at least some of them, are in this my first book, which is Beyond the Self, Healing Emotional Trauma and Brainspotting. You can have it if you want in Amazon. Now they have also in print on demand. This is the information we will see at the end of the webinar. So I want to share, as I don't know many of you, your level of knowing about the concept of trauma. So I just want to share some ideas of these concepts of trauma. I inspire myself a lot in Pianet. And Janet defines trauma as the result of exposure to an inevitable stressful event that overwhelms a person's coping mechanism and cannot be integrated. So here you have the two main important ideas. The trauma is something that we feel and we have to face, inevitable. We can't escape. But the other idea is that it's something that overwhelms our coping mechanism. So something that we are not prepared to or we are not accustomed to. Peter Levine also tells us that trauma does not lie in the events that happen to us, but in being caught in our primitive responses to painful events. It originates when we are not able to release blocked energies, when we cannot get over the physical and emotional experiences. So again, here is another very important idea that the trauma is kept in our bodies, in our nervous system. We were not able to end these responses, physical, emotional, even cognitive responses. So they are stuck in our bodies. And trauma is what we retain internally in the absence of an empathic witness. That's another important idea. So it was not the event itself which traumatized us, it was the lack or the absence of someone who can be important, bigger, and strong, who were able to accept us, to hold us, and to help us to overcome compassionately our pain. So now thinking this pandemia, we all are under such amount of stress and potential trauma that our supporting system is not available. So I don't know in your countries, but in Spain, and as you know, also in Italy, and now in the United States, is being very, very hard. Almost every one of us has some person or some relative that is ill, severely ill, and many of us even with dead people, close people. So we all are passing very strong situations, very hard, very, very high level of stress. So all the system is living kind of same circumstances, and the threat itself, even the threat is not perceived by everyone in the same way, but our subcortical brain is reacting to the threat in some way. So more about trauma. Therefore, approaches oriented to trauma treatment must necessarily contemplate working with the body. Trauma is how our body responds to the threat. So our nervous system is reactive, is over collapse. Also, Bessel van der Kolk says that we have to do limbic system therapies to heal our subcortical brain. And as you know, Brainspotting is a therapy of our limbic system, our body. We want to bridge as soon as possible our new cortical brain and to reach our experience in the body. In other words, we have to let the story be told from the bottom up so that it reveals the entry of fresh information from the sensory organs and the body. So I don't know how to explain this because all of you are very knowledgeable on doing brain spotting. So we want to organize an environment, an internal environment, but also an interpersonal environment in this dual attunement frame to help the body and the subcortical brain to tell its truth in its own language of sensations, emotions, images, and also language. So the COVID-19 is an existential trauma that most deeply affects our survival strategies that are still not updated. It means that we are now living and perceiving these conditions of confinement in many, many different ways. But these common denominators, which are feeling isolated, feeling controlled, feeling trapped, um, feeling in fear of death or feeling severely ill, these issues are triggers that can awake early traumas. Issues around attachment trauma, so feeling distant to our caretakers, isolated. I was working last week with a patient who this sensation of feeling isolated and distant reminds him a period of time on his childhood when he has a lot of interventions and hospitalizations, and he felt so far away, so distant from his parents and in the hands of people that he didn't know as a child. So this reminds him the pain in his body and the emotional pain of feeling alone and abandoned. Issues around development trauma also, about loneliness, feel trapped or controlled. Also this week I was working with another colleague, and the sense of feeling controlled and feeling and living as also the neighbors persecuting or just calling the police about seeing others playing basket in the street, or this sense of being controlled and being persecuted reminds her the sense of being in a war. You know, she was not in a war herself, but it triggers and awakes a lot of transgenerational memories of coming from her grandparents who were in the Second World War. So it was very, very healing, this process. But you know, these organizers, these triggers, currently live in this situation, awakes early traumas. And also survival issues, so previous traumas around illnesses, accidents, disasters, etc. Even collective traumas, such as the 9/11 or the terrorist attack 2 years ago here in Barcelona or in other countries. So I want to share also some ideas about the psychological impact of the quarantine. These ideas are extracted from this article, who was published on February 2020 in The Lancet, the psychological impact of quarantine and how to reduce it, rapid review of evidence. This article is a meta-analysis of many other researches, and it shows some common denominators in all these research. I just want to share some of them. Two terms we need to take into account in this situation is the term of quarantine and isolation. Quarantine is the separation and restriction of movement of people who have potentially been exposed to a contagious disease to ascertain if they become infected, so reducing the risk of them infecting others. In this pandemia, we are all quarantined without discrimination. All the people in the country, all the countries in the world, from India, Indonesia, United States, South America, every country. And isolation, which is the separation of people who has been diagnosed with a contagious disease from people who are not sick. So we can be quarantined, and even inside of our homes, we can be isolated. Or even if we are ill, I personally have my sister-in-law in the hospital for now 1 month with help for her breathing. She was fighting a lot to live, to survive. Fortunately, she's becoming better now, but it was a big stress for all the family. And she was isolated. Her husband nor any one of us could visit her. So it's terrible. In Spain, we are near 20,000 deaths now. So many people are traumatized because losing their relatives who passed away, and they couldn't say goodbye, couldn't accompany them. And this is going to happen in many countries. Another implications comes from the separation from loved ones, the loss of freedom, uncertainty over disease status, and boredom can on occasion create dramatic effects. This is mainly affecting children and adolescents, who, especially adolescents, are in this turbulence of a lot of hormones and creating these bonds with the friends. And they have this difficulty to control their impulses. But for sure, for all of us, suicide has been reported, substantial anger generated, and lawsuits brought following the imposition of quarantine in previous outbreaks. I have heard that in the States, the rate of suicide grows from 0.9 to 5% in this pandemic. Immediately after the quarantine period, 9 days after, having been quarantined was the factor most predictive of symptoms of acute stress disorder. And quarantined staff were significantly more likely to report exhaustion, detachment from others, anxiety when dealing with febrile patients, irritability, insomnia, poor concentration and indecisiveness, deterioration work performance, and reluctance to work or consideration to resign. This morning, just this morning, I was reading in one of the most important newspapers in my country that a doctor, a gynecologist, has a graffiti on her car calling her, insulting her as an infectious rat. So these people, that health practitioners, are helping us a lot. And now they are becoming to be stigmatized. This is horrible. So we are seeing the best and the worst of our humanity. The effect of being quarantined was a predictor of post-traumatic stress symptoms in hospital employees, even 3 years later. So begin to think how a huge effect this quarantine, this pandemic is going to do in our collective population. And we should be prepared to receive this amount of request and trauma. More details. For healthcare workers, being quarantined was significantly and positively associated with avoidance behaviors, such as minimizing direct contact with patients and not reporting to work. This is already happening, at least in Spain. Healthcare workers who had been quarantined had more severe symptoms of post-traumatic stress than members of general public who had been quarantined, scoring significantly higher on all dimensions. So our colleagues from the the health system, they are living in a very high stress. They are fearful, scary for their life, but they are also afraid of being contagious for their families. They are dealing a lot of hours daily with a lot of stress, with lack of resources, feeling sometimes that their colleagues are not supportful anymore. Even their own colleagues are fighting for the materials. Even their colleagues are accusing them or even avoiding them if they are infected. Another study showed that those quarantined for more than 10 days showed significantly higher post-traumatic stress symptoms than those quarantined for less than 10 days. I don't know how much you are now quarantined in your countries, but we now in Spain are in the 5th week, and as far as I know, Italians are in the 6th, I think. So think about how the effect of being quarantined is going to impact the population, the stress of the population. More than this, what about other issues? We are now knowing a race in the intrafamily violence. These couples that were not in a good state now are even more cruel. We know that there is a race of divorces, and we know that depression of family members. We know that the lack of rewarding and the activity is affecting the generation of dopamine, and dopamine is directly a hormone of well-being. And also we know that oxytocin, which is the hormone of connection that creates in connection, is a hormone of well-being, is in this situation also in big trouble. Some more things are around the quarantine and this pandemic are around, for example, finances. This research also found that financial loss as a result of a quarantine created serious socioeconomic distress and was found to be a risk factor for symptoms of psychological disorders and both anger and anxiety several months after quarantine. Many became dependent on their families to provide for them financially during quarantine, which was often hard to accept and could cause conflict between members of the family and generations. And participants with a combined annual household income of less than 4,000 Canadian dollars, so with significantly higher amounts of post-traumatic stress and depressive symptoms. This is not an exhaustive study of data, but they're just some ideas of how many factors are affecting our health currently. I want to end this part of the webinar showing this graph view of the emotional impact of the pandemic. This is from Pilar Jericho. And you have here a curve of different states of experiences, how we live this quarantine. And I think really that all of us pass through all of these stages. The first was called the call. When we began to hear about a new virus in China, but we felt this so far away, but we were not worried. So me, myself, but I think that 100% of people. First stage was denial. We heard about this. This is not going to happen here. We in Spain were hearing about the effects in Italy, and we were still in the streets. We had the week before of the confinement, of the quarantine, a massive gathering in the streets for feminism. You know, many people infected in these gatherings. We were still denying it. Just 1 week before. Third stage is rage against politicians, against people in the street. People do not follow rules. Why didn't we act before? We are accusing our politicians. We are seeing in this week even Donald Trump accusing and even giving up of financially supporting the health organization, World Health Organization. So he's accusing now. He first says that the Chinese were dealing well with this pandemic, and now he's accusing this mental health, this health organization, and Chinese. So everyone is accusing others. The fourth step is fear. Fear about our health, our vulnerability, what will happen to me. Next step will be acceptance, and accepting our vulnerability, accepting we are sad, accepting we are far away from our relatives. So just check in what stage any one of you are, or even your country, in what stage it is. If we overcome this curve, we can go to the next step, which is called New Habits and Trust. And in this step, people can begin to think on caring oneself, themselves, or how to help others. We in Spain, many organizations of psychologists and psychotherapists are creating task forces of volunteers offering free help for health practitioners, or people in the first line of help for everyone affected. So we in the Spanish Brainspotting Association, we create a task force of 100 volunteers. So many people are now offering their help to others. The last step could be when the pandemic is over and we could go into this reflection of what did I learn, or what did we learn as a society. And I will talk later on this more. So now I want to go into the second phase of the webinar, which are talking about some guidelines for crisis intervention. I will differentiate between intervention in crisis and in intervention in a deeper psychotherapy, if could be the case. So in this pandemia, our limbic system triggers our fear or flight response, rage or fight response, and collapse freeze reactions. David Grant, our mentor and master, calls this limbic countertransference. You know, we are surrounded by a threat, an invisible threat. We do not see this virus, but we feel that it's around us. So, as you know, when we live under this threat, the one in the brain who takes charge of our life is this subcortical brain. This is wired to survival. And this subcortical brain is now awake, now triggered in all of us. So therapists should first be able to listen and embrace our own internal states, so then be able to be placed in a higher state of consciousness, of presence. If we want to help the suffering of other people, we first need to be able to face and embrace our own suffering. And again, inspired in Pianet, we need to be able to feel our experiences, but not to be our experiences. This means that our prefrontal cortex can again be switched on and act as an internal regulator of this subcortical brain. But we also know that in this area of our brain, the prefrontal cortex, resides the capacity of meta-reflections, or mindfulness, the brain's capacity for the brain to look and observe itself. So we need to be able to place ourselves in this circumstance, in this creating this internal environment, to listen our fear, to accept our fear, our wish to fly. Many of us probably will have dreams about the needing of flight, or the need to give up to take care of others. Some of us feed to take care of others. We need time for ourselves, especially psychotherapists or people that have young children around. These young children are so demanding now, and so now only dependent on their parents. They are not in school, so the source of their well-being, their playfulness, are parents. And many of us has to work from home, trying to manage our time to dedicate to our work and time to dedicate to our children. It's not my case because I'm just grandfather, but I have many colleagues in this situation. Rage. We need also to be able to embrace our rage, our feeling irritable or exasperation towards people who may consider weak, dependent, and these reactions also impulse us to get rid of these people. Or collapse. We could begin to feel numbness sometimes, feel lack of control or focus, to feel that we are living in a movie of science fiction. We can find ourselves with difficulty to think clearly or to fall asleep, etc. So this means that our subcortical brain is talking a lot, very loudly. From our compassive observer, which I call the essential being in my book, we can embrace our inner states, take them in, listen and calm them down and care them. We need to create this internal environment of friendship with our own emotions, our own experiences. So as I told before, being able to embrace with compassion other suffering requires to embrace our own. I'm a follower of this master, Thich Nhat Hanh. Maybe many of you know it. He has this slogan, no mat, no lotus. So in our society, we want the lotus, we want the flower, we want the beauty, the happiness. And we deny, and we try to do as much as possible to deny from our pain or suffering. But this slogan is very, very wise. You know, we couldn't have the lotus if we wouldn't have the mat. So from suffering, we will get a nice flower. We are prepared as psychotherapists to accompany this, to follow this, to help ourselves and to help our clients to trespass their suffering, to transform in a flower, in a human quality, nice, positive quality. I like this idea. It's also inspired in the teachings of Thich Nhat Hanh, of seeing our consciousness as a garden and seeing ourselves as gardeners of our consciousness. Here you have the map or a representation of our consciousness, and we have a store of our consciousness, and we have a stage of our consciousness. In this store of our consciousness, we have all the seeds of the different experiences we can experience in a latent state. We have the seed of hate, we have the seed of rage, the loneliness, ignorance, discrimination, fear, treason. But we also have the seeds of love, peace, joy, and also the seed of mindfulness, of presence, where we take our attention, we water these different seeds. If we water many times per day the seeds of hate, fear, loneliness, isolation, these are the seeds that are going to flourish in the stage of our consciousness, including us, hijacking our sense of self. So I will talk later deeply on this. But for now, talking about our limbic countertransference, we need to find our inner island of peace. To not expose ourselves to such amount of stimulus scaring us, but also to find ways to take care of us. For example, to nourishing ourselves with the teachings, with practices and teachings from spiritual masters, or reading inspiring books, etc. But another idea of this draw is we need to water the seed of our mindfulness, our presence. You can see my pointer here. So in a way to awake, develop this, our mindfulness, our compassionate observer, or what I call the essential being in us. From this state, which is a meta-reflective state, we can embrace all the rest of our experiences, the good ones, the positive ones, but also the ones that inform us of our suffering. So this is a way as we take care of ourselves in the same way as a good mother also take care of her baby. Our emotions are part of us, not all of us, but part of us. Again, we need to be able to feel an experience, but not to be the experience. Experiences are transitory, has a beginning and an end. But this state of consciousness is here forever, always. So second step is accompanying. If we are in a team of crisis intervention, and the goal is not to provide deep psychotherapy, but to try to prevent the majority or the big amount of the population to not go into a post-traumatic stress disorder. So the main goal is stabilization to containment in support. So these ideas are organized around this goal. This is also supposing that we are going to deal with many people that we don't know. We do not have, if we are in an emergency service, we can attend people we don't know. We do not have a previous relationship. So it's good to try to create this as fast as possible, as soon as possible. So introducing of the practitioner who will assist the client, telling our name and establishing a confidentiality agreement, telling the person that everything he or she is going to share with us is confidential, is only between both of us. So many people are not knowledgeable about this kind of services. Many people never ask for psychological help. Third step could be providing some brief psychoeducation, if applicable. You know, if the person is already in an emotional state of overwhelming and needs to ventilate, we need to provide this in an attuned way. You know, but the essential message about this is about the normality of a stress reaction in a situation that is abnormal. I will extend later in this. Next, we can ask him or her to describe how is he feeling and what are the circumstances at the moment. This is giving permission to ventilate, to tell his story in his own way. And the most important attitude of the therapist here is to perform empathetic listening, while we are offering recognition to the emotions, validation to the importance of the emotions. We saw some tears in the client. Validation means there is something important in these tears. Just listen to these tears. Give time and space to these tears to express. And normalization, which is just convey the message that it's normal to feel vulnerable, to feel fear, to cry. Compassionate listening is first, and allowing emotional ventilation is first to any technique. Past trauma may come in this time, but it's good to try to focus on the current one, in the current circumstances. As we do not know if we will have enough relationship, enough time to provide this deep psychotherapy. That could be enough for a first session. And then appreciate the trust on us and schedule, if it's possible, for a next visit. I want to share here some ideas adapted from Bruce Perry, this neuroscientist pioneer on the field of trauma. In this draw, he's illustrating the steps for our mind to be able to reprocess. You know, these are the 3 R's. In the base is regulate. Again, if you are seeing now my model of the brain, regulate means to have this subcortical brain to go into regulation. It's not possible help with this if the therapist, the helper, is not himself herself in this state of self-regulation. That's why I was talking before about just creating this internal environment of finding our inner isle of calmness. Second step is helping to nervous system to relate, which is in polyvagal theory. This is in awakening this social engagement system. You know, the connection between 2 human beings. So the person can come in a state of high arousal, high anxiety, and in this state, she is not still connecting, relating with us. She's just expressing these overwhelming emotions. So second step is help the person to connect with us. Just in this sense of connection, the subcortical brain is calm enough to allow the prefrontal cortex to calm and to do its job, which has to be with reflection, meta-reflection, learn, healing, and mindfulness. Just be in a state of self-study mode, embracing and listening, relating with his, her internal experiences. This intervention in crisis, we need to take into account that it's a prompt and brief in time intervention. Yes, currently I am attending to a training designed to intervene in big masses, big public in South America. They organize interventions in 20 minutes, just 20 minutes. They have a lot of experience in other pandemias and helping many people. So again, we need to take into account that we don't know what is going to come to us, but we need to be prepared to do these very brief, prompt interventions. This with a specific goal, that is first lower emotional activation and prevent traumatic memories and prevent post-traumatic stress disorder. It is not a psychotherapy. This will be done later if requested. Or in these interventions, we can detect what people are more vulnerable and need deeper psychotherapy, and we can refer to a psychotherapist or to another colleague or to another professional, or maybe requests if we are able to go into a different phase of psychotherapy. We work with an unknown population. Many of them may have previous trauma. Many of them do not have any previous experience with psychotherapy. They don't know to what is for psychotherapy. So we need to create this sense of connection, safe environment. Detect in the first inquiries if it is advisable to reprocess memories, or rather proceed to the stabilization and functional management of the situation, which means connection with reality, connection with their social supportive system, connection with their resources, etc. Some red lines here to decide if we can go to a short reprocessing or not are detecting if there is severe dissociation or psychological or psychotic outbreaks, And in general, those patients who lack sufficient capacity for emotional self-regulation. So this is another goal in these first meetings. About some psychoeducation, should be brief also. The main message is to indicate that the symptoms are normal, although extreme, in this extraordinary situation. Detail some cognitive, physiological, emotional, and behavioral symptoms, normalizing the experience. So many people are experiencing these extreme symptoms for an extraordinary situation that are common to all human beings, which can be felt as intrusive memories, dreams or nightmares, or flashbacks, or in the emotional field as numbness, dullness, avoidance, hyperactivation, etc. Most of people do not know these feelings. They could feel they are out of control or they are crazy. So it's good also to reinforce some sense of control. Ways to self-care, or for example, advise them to limit the input of information, to not be exposed all day to the news. For sure, follow the rules indicated for the population and generate healthy habits. So all of you know this, and routines that we can control. Self-care is, I don't know, many of you has different backgrounds in this, but you know, just using this kind of blanket and put around the body for some of them to provide a sense of being warm, being embraced, or some exercises, just embracing oneself. You can be creative in how to implement this sense of self-care. But also important for you to speak in a soft voice, soft but safe and slow. This is using the cues of our social engagement system, this branch of our vagus nerve, the ventral vagus branch of social engagement, which takes these main cues of facial expression and tone of voice. Their neuroception is always trying to pick up these signs of safety or threat. So it's very important you to be prepared first to meet with any client. Some of the topics, the issues you can find in this kind of clients that fear in waves with each new information. We have new information almost every day, for sure every week. First information about China, schools closing, then the nomination of a pandemic, but imprecise information. We should use masks, we should not. We should use gloves, we should not. So we need to, we are in this uncertainty so much. Issues around child or family members having high fever, feeling scary for the health of the family, or anger towards those who underestimate and do not adopt appropriate behavior. We are here now in Spain, being how some neighbors are accusing other neighbors of being in the street or working with the dog, or you know, so many people is feeling in this anger, impotence, on not feeling powerful to do any useful thing. We are knowing also news from doctors worried about having to choose who to reanimate and who do not. So this also was heard here in the news, that some doctors has to decide older people just to let them die. We have, I think, nearly in Spain, 10,000 deaths from old people in residence for older people. Half of the population, you know, so they are weaker. But in the hospitals, one criteria of to whom to provide breath support or not was age. The unpredictability of things, life, planet, and without certainty of the next day. So we do not know how life is going to be. All we know is that it's not going to be the same as before. So this is a grief for all of us. Anguish of death. Who will they give priority to? Or blame yourself for thinking those things, to be selfish? The issue of work block, what was created in years now collapsed. Many businessmen, professionals, practitioners are now in bankrupt. Issues dealing with feeling this invisible enemy that destroys everything, destroys our life, destroys our systems, living with ups and downs, being accused of being infections. I put this example of this medical doctor this morning that has these graffitis on her car of being called infectious rat. And this is also happening between health practitioners in a working environment, but also with cashiers from supermarkets, soldiers that are helping now in Spain. They are spelling out of their homes. They are being invited to live in another apartment, in another place. Issues around feeling weeks without being able to see the family of origin, or even worse, people that are living alone. They can't have connection with the closest ones, or having sick children or sick family members, just in the emergencies units fighting for life and not being able to connect, to have news. This is my experience. We're waiting once per day to have some news from the hospital. We were waiting 24 hours till the next day. Mourning family or friends, not being able to go to the funeral. Again, Spain is only allowed 3 people to go to a funeral. This belief in thinking it was something so big and important. The inability to see and speak to sick relatives, which I talk about. The connection to former collective traumas. We in Spain, just less than 2 years ago, we have this terrorist attack in Barcelona. Recently was in Paris, 9/11 in New York, and in any of your countries, all of you has collective former traumas. Many people is awakened, is triggered because remembering these past traumas. Feeling of being on pause, life on hold, is kind of science fiction to go in the street and not seeing anyone, any life, human life. The issues around social isolation for children, adults, conflicts inside home, lack of contact, the interruption of routines, such as not being able to greet in the usual way, domestic conflicts, not being able to embrace in the countries that are Latin, Mediterranean countries, to hug each other. It was a normal way to greet people, which is not going to be possible for many months, probably. And especially for health medical staff, which I think, as you saw before, is a target population which is going to suffer more from post-traumatic stress disorder. We have this experience already in our therapies in Spain, that some of them feeling that the enemy is the colleague at work. They were fighting for having material, having masks and material for work, or fear of infecting the family. We have colleagues therapists that are married with medical doctors, they can't hug their husband or their wife at night, nor the kids. Loss of companions. So many of them lost colleagues because they died, and feeling helpless. So third step could be, in a third step or third session, could be teaching resources and helping to organize this sense of being able to listen internally. So in this phase, it is important to teach breathing resources and self-soothing to calm down the autonomic nervous system. This is the main goal, which is, the goal is to do something to prevent that this flashback, this emotional memory, consolidate and crystallize in a post-traumatic stress disorder. Okay, here teach grounding and focusing resources. I will explain more in the following slides on this. But this third phase is also to help the client to contemplate and to listen to the emotions and sensations inside. Same idea of helping the client to be able to relate with her experience, but not to be her experience. So help the client with our language. We are going to hear that feeling, that sadness. Just give time to these tears to be inside of you. Just be with them, to listen what they are telling to you. So in this way of talking, I can't expand more on the using of language, but this way of talking is creating this dual awareness of some level in the client, able to listen, to be present for its experience, his experience, but another level of the client just experiencing the experience. This phase also important to recognize and reinforce the strengths that the person already possesses, their habitual resources. So it's good to ask the client, what helps you to calm down? What helps you to distract yourself? What is the best of you in this situation? What makes you more valuable? If your client is a health practitioner, they are doing such amount of things, good things. Even they feel important, they feel bad, they feel they're not doing enough. In fact, they are doing a lot. The same with a family member, with any one of us. And give permission to rest and for self-care. Some short stabilization resources can be, I like this practice also from Thich Nhat Hanh. I'm aware of my inhalation and aware of my exhalation, and do this exercise for 3, 4, 5 times. Emphasizing exhalation, as you know, enhances the parasympathetic activation. So if you do longer exhalation than the inhalation, you are promoting that the parasympathetic nervous system takes more time, more place. You know? So you can breathe with them, help them to self-regulate this nervous system. Some practices, grounding practices, as helping the client to notice the ground underfoot, or standing up if you are working in video conference, you can do with them this exercise, standing up and lead this exercise, this visualization of helping them to notice the way, imagine they have roots in the ground, and you can show them how to do this. Another, I like this practice of carrying the sensation or carrying the emotion. You've seen this photo on the bottom right. This is a Garuda Mudra. I learned this from Tara Brach in the United States. This is a mudra, and this mudra, and also Thich Nhat Hanh uses this mudra. It has this effect of harmonizing and calming down the emotion. So this is carrying the sensation, carrying the emotion. Place your hand on the pleasant or unpleasant sensation and imagine that we are taking care of it. This is very fast, very easy. So again, if you have a dysregulated client, just guide him or her to put his hands over the distress, the perturbance, and guide a kind relationship with it. Self-massage or shake sensations, shakes the body like shaking the dust. So if at the end of a session, the client still have sensations, bothering sensations, you can just guide this exercise of shaking the dust in the body. Are you seeing me? This way, okay? Or if you want to promote more presentification, that the person feels present, providing self-massage during or after the processing, just doing it very on the face, the head, the shoulders, the arms, the chest, all the body with strong massage and with guiding, being mindful of the sensations. You know, if we stimulate the body and the body and the skin respond. And what we want now is to awaken body sensations not connected with the trauma. Body sensations connected with being alive, being present, being calm, being safe, etc. This is an idea I developed myself, and I explain in my book again, this Beyond the Self, chapter 5. In this phase 3, we as therapists want to create this healing bubble. As you see, the therapists need to be in this self state of presence to provide a quiet, calm nervous system for the client to be able to get support from this quiet, safe, calm nervous system. We are mammals, so we co-regulate with our relatives, with our same species, you know. So what we want is to help the client to also himself be in this internal state of presence, this loving observer inside of him, to relate with her experiences. So here, and this is very important also in Brainspotting, in this supporting this dual attunement, the relational attunement, to help the client to just be in this mindfulness state and to keep this internal bond with his own experience, just relating with his experience, embracing the experience, witnessing his experience. This is what I call the healing bubble. We can do a lot with our presence, and we can do a lot with the way we use our language. Some also tips for self-care, which I call self-care refuges. I inspired this in some Buddhist practice, but I first practice is self-regulation. Just practice in this guide your the client to find some time to do practices of self-regulation. For any client could be different things. Yoga, if they practice yoga, or mindfulness exercise, or just short practice of relaxation or breathing. But if you use this refuge for yourself, mindfulness and meditation is very, very important. Just contact with your inner essence to place yourself is in the center of the twister. You know, the center of the twister where there aren't turbulences. and access our inner island of calm, serenity, and peace. Place ourselves in a high level of energy. This is especially important for caretakers and therapists for being able to provide this in the therapeutic relationship. The second refugee is co-regulation. Co-regulation means to create support groups, engage loving, kind listening practice. So for yourselves, to create tribes, to create sense of group, of community. We in Spain are doing, Hermano attend some of them, a series of these webinars. In fact, this webinar corresponds to one of the ones we gave in Spain, but we till now gave 10 webinars, tomorrow the 11th, to create the sense of community and support the therapists to learn and to be prepared for this. I think more than the knowledge is the sense of community. We have almost every day 100 people and more than 100 people. As you today, I'm sorry because you were 164 and not everybody could attend. But if it's for your clients, that stimulate the sense of connections, the sense of using, for example, Zoom meetings with sharing dinners with relatives or with friends, or using this video conference, WhatsApp to connect. The sense of, create the sense of tribe, belonging to a tribe. We are members of a tribe and we heal in tribes. The third refugee is spiritual nutrition, or in whatever way you understand the word spiritual, which could be exposing, having good food for our souls also, for sure for our body, but what kind of material we introduce in our minds. So me, myself, exposed to some spiritual teachers such as Eckhart Tolle or Thich Nhat Hanh or Moji or monks from privilege, but any of you have your own, or just read some lectures, some readings that could inspire and provide good food for your soul. And the fourth refugee is to take care of the body with exercise. Exercise in these times is so important to release tensions and to keep the nervous and the autoimmune system in good condition. So I create this idea of the self-refugees, for also providing a sense of control in anyone. Fourth step, and we are just close to the end of my exposition, is, if it's possible, it's not always possible, but for some clients could be possible to go to a session of reprocessing the trauma. I think that most of you know Brainspotting. So if this slide is without Brainspotting, the next one and the next ones are with Brainspotting. But if you still do not know Brainspotting, you can do this process, which is an extraction of the Aliceia method. This method we are going to train in Slovenia next October, as to get the story of the experience from the beginning to the present moment. And while the client is referring his narrative, the therapist observe moments of increased activation. So we are just observing the physiological, emotional reactions in any step of the narrative. As the worst moments, what the worst moments have been and how it feels in the body. You know, because this is very common with Brainspotting. So just help the client to focus in one scene, one fragment of the narrative, and how it's felt in the body, You can request the SAT level, 0 to 10. Again, I think here is compelling to use the body resource or any resource, not only body resource, but any resource that is helpful for the client, and help the client to, what does he need to be able to handle with this experience, or how, where the client feels a sensation in the body, which is a sensation of calmness, well-being, groundness, or any other, or also how it feels in the therapeutic relationship. Some of them could not access this body resource, but if they have a good connection with you, you can begin to do this, what I call the meta therapy. Inquire about what are you doing good for the client. And if she just tell you, yeah, you are present, you are listening, you are here for me, and you will ask for more details. How do you know I am here for you? And what do you feel because I'm here for you? I feel good. And you still ask for more. And how do you know you feel good? Where in your body do you have this experience of feeling good because I'm here hearing you, for you? So you reach this body experience of feeling connected with another human being. And yes, then you invite the client to focus the attention on the body resource, on this sensation of positive sensation in the body. And then you invite the client just to be present, to be mindful on this positive sensation in the body, but be open to embrace the story that is coming, always aware of the existence of the positive resource. If you observe that the client feels overwhelmed by strong emotions, you always can invite to come back to the experience, to the awareness, the consciousness of the positive sensation. But you also can use breathe, helping the client to breathe in, or inviting the client to breathe in his love, his tenderness, his curiosity, and breathe out and embrace the suffering. Breathe in and breathe out helps in the regulation. So it depends how many resources you need to use with the client. Normally, for many of them, just be present, be aware of the positive body experience could be enough. Then you can proceed in a normal processing, helping the person to keep compassionate, observing their experience and embracing and listening more, and inviting to come again to the experience, the emotion that is disturbing him, and invite to express more and more and more. At the end, if the activation remains, you can do one of the exercises I illustrated before: breathing, movement, dash, shaking, etc., and close the session. Well, now with Brainspotting, you all know this, but yeah, again, here you can ask how the client, how you are noticing what you are telling us in your body, the story. When the client is telling the story, just guide his attention to why and how he is feeling in the body. Or focus the attention of the client on one of the activations, the triggers of the story. Then you can begin to observe if there is a gaze spot. If there is a gaze spot, a spontaneous gaze spot, just continue with this. Just point out this. You will be using it as the brain spot. If not, you can help the client to just check if he feel more left, front, or right, etc. So yeah, you can request for the SAT level to 0 to 10. But again, we want to have all the preventions. We want to provide a nice, kind reprocessing. So always, I will suggest that always do the reprocessing, finding the body resource. Where in the body you feel a sense of calm, well-being, grounding. And then Here, you seek the brain spot of the positive resource, the positive body resource, or keep the attention on the positive body sensation. And then you, point 6, invite the mindfulness process, focus on the resource spot or the body resource. And you proceed as normal processing. Again, if the activation at the end remains, do the exercise, one of the exercises of closing the session, just breathing, movement, standing up, or giving self-massage, touch the shaking, etc. You have, this is, I think, the last slide. You can also work with this variation. You can work with 2 brain spots, an activation gaze spot and a resource gaze spot. So here, the client is invited to activate the issue, and the therapist watches where the client's eyes go in a reflex, natural way. So if you observe a natural gaze spot, just point out this. As you remember in your teachings, you can observe a primary, secondary, or tertiary gaze spot. Just check with the client what happens in any of these gaze spots. And just point out, take the SAT level 0 to 10, and then ask the client for a positive aspect or outcome of the situation, or a positive body sensation. And again, just while the client is narrating this positive aspect, you observe the gaze. If you observe again a gaze for this positive aspect or outcome, just point out this. So now you have 2 brain spots, one for the activation, one for the positive resource. Sorry. You also take the SAT level of the positive resource. Now you can ask the client, in which one do you feel is optimal to begin? The one you feel the activation, the one you feel the good positive resource. Just allow the client to choose. So the client now can, supposedly the client could choose to process on the positive brain spot. So do the most of the processing on the positive brain spot. But when the activation is going down, you can invite. I will invite, just suggest the client. If you feel it's good, you can check, just pendulating, going to the other brain spot. And be as much as you can be on this one, and just observe what comes. Or you can just suggest, well, you can just go from one to the other and at your own rate. If I normally invite this more at the end of the session to pendulate between the both. But if you feel that the client is dealing with too much activation, you can guide the client to come back to the positive one. So this is pendulation. This is a technique that is borrowed from Peter Levine, Somatic Experiences. So I think I share most of the content with you now. Thank you very much. If I remember, if you want to learn more or to know more about my way of thinking, you have my book, Beyond the Self, Healing Emotional Trauma and Brainspotting. Thank you. And now it's time for you, if you want to ask some questions, to share your experience, etc. Does any one of you want to?
Mario, thank you.
Yeah.
Has anyone any question? Okay, Petra.
Hello.
Hello.
Hello. Hi, Mario. It was your presentation. I really liked it. I also refreshed some basics of Brainspotting that I'm using regularly.
Yeah.
So my question is actually about, you know, on one side, we should be in contact with our inner states, and so does the client. When we work with the client, first, of course, we embrace our states, and then the client embraces his states, which can be stressful states, difficult, suffering states. But then when to then shift from paying attention or from mindful awareness of the difficult states to grow or to flourish the positive states?
The question is when?
When, I mean, in Brainspotting, this happens usually naturally, right?
Yeah.
But if we work, as you said, in a crisis management, we don't have so much time. Sometimes I don't know if we'll have time for, let's say, deeper processing.
Yep.
So my question is always how much space to give to the suffering emotions, and then is that enough, or should we finish up with encouraging the positive states in the client, or that he comes,
Yeah.
that he can bring that resource inside of him out? I don't know. If it's kind of
well, you know, this is it's a complex question with a complex answer. You know, if is most of my clients are my clients, so I have a lot of a strong relationship. So I know very well how they can reprocess, so and how they can hold these strong emotions. You know, so it's not a problem. But if you are treating some person you don't know enough, it's very important you check about this, how he or she handles her strong emotions. That's a good question to do to them. How you handle your strong emotions? What kind of resources you have around you? Your social support. Just check some things about how the client handle the emotions and social support and previous trauma and resources. If you have the idea that the client has enough resilience, you can invite another very important variable is the connection with you. You know, I told Gregor Svelts in his home, as much presence you provide, as less you have to do. That's a correlation. Your own state of presence, your being. Presence is being, not doing. So when you pass to doing, it's because could be because you do not have enough presence, full presence, or that the client is not connected with you. You know, so first is just check if you have enough presence. Second is help the client to connect. You remember the slide of Bruce Perry? Regulate, connect, reflect. That's very important. You can see if the client is in what phase is in lack of regulation. So first is help the client to regulate. Do you see me this exercise, for example? To help the client to have some sense of containment. For example, then if you can provide these external resources, even if you have this blanket and
I don't know why I cannot see you.
No, you can't see me?
I see still the presentation.
I'm seeing you. Sorry.
I don't know.
No?
Yes,
No?
now I can see you.
So now, if you do this very strongly, and if you have another one, and again, that provides a body sensation of feeling whole. For example, this is creating also external resources or with external things, a sense of feeling contained, whole. You know, this is helping a lot for a client that is a lot of dysregulated. So again, if you see the client is too much overwhelmed by the experience, and you are seeing that the window of tolerance is too much out, you again just invite the client. For example, if the client told you at the beginning that his positive sensation was feeling the arms over the chair, or breathing and open sensation in the chest, you can always ask the client, do you feel still this sensation of your chest, open chest? Many times the client says, yes, it's not very, very high, but it's still there. So you just help the client, you guide the client, just be to this sensation again, call the sensation to come again, just be there for a while. Just be there for a while. And from here, just be open to what comes. So you can pendulate. If the client is too much overwhelmed and can't do by himself, you can guide him. You know, or if you are working with these two brain spots, just again, lead him to there. We do not want the client to suffer too much, especially if you don't know how the client reprocess. So you need to take much more care with this, because the goal is to prevent, to help to stabilize, to connect with life. Do you have the answer for your question?
Yeah, I have the answer. Thanks.
Okay. Any other?
Can I ask something? I'm Ariel from Paris.
Yes.
I move my hand.
Yes, Ali.
Okay.
Yeah.
Hi. I'm very surprised. I mean, let's see. I think it's a good thing, but maybe more than half of my patients are feeling okay. Let's say I'm Gestalt therapist. Yeah. So they're used to work on awareness, on mindfulness. They have tools like drawing, the anger, the fears. I mean, they know how to manage their emotion. And so I'm surprised. Are they really good? I mean, are they feeling really okay? Is the effect of all the long time of therapy? Or do I miss something? Or, you know, I don't feel comfortable. They're feeling comfortable and I feel uncomfortable because they feel comfortable. I'm afraid, you know, that I think my fear is then a trauma comes back suddenly, and maybe that's the point. And we didn't manage it, you know. Comment on dit, une réminiscence, like a flashback of a memory that we didn't work on or something, and we will get it in 3 months or 6 months. So I think I want to be a perfect therapist. So I don't know if you have anything. It's strange, you know, so many people are feeling good, and I can feel the fear, the anger on myself. I check myself. I was away for 15 days just to feel how I can manage myself. What are my emotions? What are my fears? Just to prevent the countertransference and to be aware also, because like it's new, just to try to understand a little from inside the situation. So what do you think?
Well, first thing is I hear that it sounds you have an impatient part of you that is pushing to find the pain. Just be quiet is the best, but be curious on knowing this. you know, if you, I don't know, any of your clients, it's surprising to me what you tell, because it's not my case. And I have
Yes,
clients that they have a lot of work in their shoulders, you know.
yes, it's
But anyway, they are dealing with different things, the different issues that in any other in other times of their life, you know. So just be curious on knowing how you handle, how you dealing with your family. If your client has young children, for example, they are facing with a lot of stress, sure, but just fish, you know, just ask for the situation. So be very, very attentive of where, as I told my students, dissociation is only perfect once in life. You know when?
no. So
When the dissociation is just perfect. It's only once in our life. You know when?
no, no, don't know.
When, you know, and
I don't know.
when we die? When we die? Our soul leaves our body. That's perfect. The rest of our lives is not perfect. It can be extreme, but if we just wait, if we just call the experience of the client, we can see in any moment a small sign of emotions, physiological reaction. So just be curious. Do not push, but just
No, I don't
watch.
push. It just look like it's okay. So I work on the resource, the resource. What resource you have? Just
So another way is real is just to pick your client where your client is. If he is saying I'm okay, I'm dealing well, and you can begin with this and ask your client, well, teach me how you manage this. You know,
good.
that's
That's
not
good. I love it.
that's not my
I love it.
experience. You know, I feel vulnerable. I sometimes I feel good in general, but sometimes I have a
Okay.
part of me is worry about this. Another part of me is worry about this. Another part is sometimes sad. But I would like to learn from you. How you handle you?
That's
Teach me.
very clever.
Teach me. You know, and
Good.
in this narrative, you will probably will find out the vulnerability of the client. So
Thank you.
this can be said for any of your clients. Take your client where your client is,
Yes.
and work with what your client is showing you, and yes, call for more information. Yes, as an expert in trauma, you know what you are looking for. You are looking very selectively for these signs that sometimes could pop up from the dissociation. But we have to wait, you know, because many clients, depending on their personality traits, but depending also on their role on their families, they have to be strong all the time.
Mm.
You know, so it's for some of them it's so scary to just relax the defenses and feel they could cry endlessness. So just be quiet, but as a trauma therapist, be very selective in your observation.
Yes.
Knowing that dissociation is not perfect. Makes
Yes.
sense?
Maybe I'm too impatient. It's why I was saying I want to be the good therapist, you know, but now I think it have to come. Now they are going on their resource. They know they have a resource. So I think it's a way of containing the situation to think, oh, I can paint. I have some comment on dit projects.
Yeah.
Some goals.
Yeah.
I have some goals. I have some. Yes, I can plan a lot of things.
Work without goals.
So
work without goals. Work without goals. Well, the general goal is stabilization, help the client to. But a more open goal is just to embrace the vulnerability of your client.
Okay.
That's very general goals. And if your client is just telling you, well, I have to be strong, I have to be strong, I have to, because I am the head of the family, because if I just broke, my wife could broke, or I'm all the time doing things, and I'm all the time doing things because I don't have time, because my kids are asking me, requesting me things, and I have to do telejob, and I have to clean my house. That's the situation in Spain, you know. So these people are so busy, are even more busy than normal. Sometimes they are in this action. You know, so you can just begin to point out time to time, well, so it sounds that you have a lot of burden inside of you. You have to be so active, taking care of so many things. And the client can respond, yes, it's too overwhelming for me. So you can begin, so you can begin to now awaken the other side. So you are so much taking care of others. And it sounds like part of you is just not having anyone for you, nor even your time for yourself. So it sounds, it's a part of you that should feel alone. Make sense to you?
Yes, thank you very much. Very interesting.
Okay. Yes.
Maria, can I say something?
Yes.
Tomas from Slovenia. I think that the situation here is not so traumatic as it is in Spain. I'm reading about the situation in Spain.
I know.
And it's different. And I have clients who have developed a peculiar sense of guilt, which is that they are enjoying the situation.
Yeah.
So they are not really traumatized.
Yeah.
And I mean, these are people who are doing well financially, and finally they have time for their families.
Yes.
And they're feeling guilty because of this. So I don't think everybody is traumatized, and not necessarily everybody is dissociating.
No, sure. I didn't say this, or at least I don't want to assume this. It's also true here. Last week I was talking with a group of friends, and one of them, my friends, were saying, well, it's a good time for me. I have more time with my daughters than ever. I have time to share with my husband. I'm very creative. So some people, because they are resilient, they are dealing well, and because they have a good condition. So it depends on so many things. But I was talking more about the collective in this. Not everybody, not 100% of people is going to be traumatized. I don't know how percentage, I don't know. It depends on the country. For sure, we will have much more people traumatized in Spain than you will have in Slovenia, sure. And United States will have more people traumatized than Slovenia. Or Italy, sure. I can say for sure, you know. So I was normally referring to this more vulnerable population, the ones that have lower financial power, for example. Many people is going to live with a lack of financial resources, and even lose their jobs, their apartments, so this is coming. But different countries will have different situations. So I agree with you. Not everybody is dissociated. Not everybody is going to be traumatized. But much more than before, sure.
but to join also your side, I think that there are people traumatized who really don't take into account that such help is there, that it's provided, because also here we organized into this help, telephone helpline. And not many people, at least at the beginning, were calling. Now, slowly, they are starting to call. So it's an interesting phenomena that also colleagues in other countries observe, that there are many people who are willing to help, who are, competent to help, but not so many people are asking for. I don't know if this is the situation in Spain too, but this is something we are facing here.
Well, it's similar here. We organize this task force for mainly for these practitioners in the first line, as health practitioners, firefighters, policemen, and people that are working in supermarkets that now are being stigmatized also, and they are living in fear, you know. But they are not asking for help so as much as we expected. I know because I have some friends that they are medical doctors that they are so overwhelmed now. They are working for 10, 12, 14 hours per day. They just need to go home to try to rest. They can't touch their husbands or wives or children. So this is going to come later. Some of the data I share with you showed that the post effect of this is going to come still. Now we are in the phase of the shock. Some of them are suffering a lot now, but they do not consider asking for help. This is going to come later.
So you are maybe also suggesting that it's important to provide for help also after the pandemic ends, so that there's going to be a bigger wave of requests for help.
Yeah, that's my expectation, and the expectation and what data says in studies, and this I have this connection with this doctor from South America who has a lot of experience in pandemias, and this is what she says also, you know. But this is so new for every one of us that we need to be prepared for what could come.
Thank you, and it's good that we all share together.
Yes, this is our tribe.
Yeah,
this Brainspotting tribe. Anyone more want to ask any question?
Okay. Hello.
Hello.
Okay.
Hello.
I'm
Gisela.
Gisela. Yes, Gisela. I'm from Jakarta, Indonesia.
Yeah.
Okay. Thank you again for the explanation. It's really, I like it so much. And there's one, I think it's technical questions. You explained that there's a 4 phase in this intervention. Is it meaning that we have 4 sessions for this client?
For patients, you say?
Oh yeah, 4 phases. Your
4
explanation
phases.
in your
Yeah.
Phase 4.
Yeah.
Yeah, there's phase 4, 1, 2, 3, and 4 phase, right? And then is it that we should see the client 4 sessions, or is it any other any other suggestion? Is it
No.
yeah.
As I told you at the beginning, when I first planned this content of the webinar, I was thinking on organizing a task force of volunteers that could provide help for a huge demand, you know. A huge demand of people, which is not happening. But we offer this team of volunteers. We offer for free 4 sessions for. If we have a huge demand, we can't give a long-term therapy for everybody. So the goal is stabilization, is preventing post-traumatization. Said is, this could be very flexible. If we do not have this huge demand, or if you are just attending 2 people, you can be flexible. That's your time. If you offer for free, I will suggest you to do not offer for an endless period of time. Yes. You know, yes, you can offer, well, I can offer 10 sessions for you in this frame of free help. If you need more, we will talk later on how you could continue, or if you want to continue with another person.
Depends on the.
Sorry. Yeah.
I'm sorry. Okay. Depends on the clients, right? On the needs of the client intervention.
Yeah, it depends on the client, but depends on the country situation also.
Oh yeah.
You know, yeah. If we have, as I has this expectation that many people will be asking for help, we couldn't offer 10 sessions for everybody. You know.
Yes.
So that's the goal in crisis. Hermano is here also. Hermano has experience on intervening. Hi, Hermano. Intervening in collective disasters in Italy. Do you want to tell something about this, Hermano?
Oh, yes. Well, I agree with your presentation. I like your presentation. And I think that in Italy, we saw a lot of protocols from many society of psychotherapists. But I think that the first more important issue is the connection, is the relationship, is the most useful, because in Italy we work in a telephone line for I work for as a volunteer, and we have 20 minutes just to hear the people, listen to the people, and offer our care. And so in 20 minutes, we can just offer the presence, the closeness, and nothing more, because you don't have the time for doing grounding or brain spotting. Even it's a big help for the people that call, because sometimes, most of the time, in 15-20 minutes, people are they feel better, because they have the connection, because they are separated, they are in their home from 30 days ago. They are alone, they want to talk with someone, and 15 minutes sometimes it's enough, but it's not possible to do a lot of work. This is my experience this time.
Yeah, it depends on the amount of the request. But even in 15-20 minutes, you can do something such as doing this kind of exercises that are very, very powerful for self-soothing and calming, and providing this sense of parasympathetic activation that will help this intense activation to slow down. And this is another principle in trauma treatment, that to provide a sense of, you know, trauma sensations feels for the subcortical brain as endless. They don't have borders. So to put this for example, this is to provide a physiological experience of a border, but also the sense of warmth and self-love, self-compassion. So it acts in different ways, because this activation It feels as flooding all the person. So you put this border and has an end. And then you begin to establish an internal relationship, caring, warm relationship. So even in 15, 20 minutes, the goal is just to help the person to go into a more parasympathetic state and social engagement connection, which is the root for healing.
Yeah. Another issue is to have for us as a psychotherapist in the emergency a group, a connection, as you told, because it's very difficult. We must be prepared at the extreme situation, and sometimes are a lot, and we have to share with our colleagues most of the time our experience, just to debrief sometimes, but it's very important. This is what I noticed here in Italy.
Yeah, that's another very important point, Hermano. We know from research that when these collective traumas, helpers got burned out very soon, you know, because we are so exposed to such amount of suffering, human suffering, that our mirror neurons are replicating this suffering. But in this occasion also, we as human beings are also suffering. We have our own family conditions. We are exposed to the same threats. So as caretakers, we are suffering because of the same stimulus. So this is very important, the sense of connection, the sense of creating a tribe, a community, a way to connect and to debrief and to be listening with compassion. Yes, if I will have to teach one tool to a psychotherapist, only one, it will be compassionate listening. Compassionate listening. You should know how much healing you can provide just doing this compassionate listening. Then if you add Brainspotting on another tools, that could be much deeper. But if you only can use one, use this first, always. Any other question? Okay, maybe
we can go to the end.
Yeah, just to check with you if this content was helpful for this situation. It provides you with some tips to, yeah.
Mm-hmm. Also, if you saw in chats, it's a lot of thank you, that it was very helpful and very rich.
Okay.
Mm-hmm.
Well, my goal was to try when I invite this international training community of Brainspotting to do this for internationally, but because people maybe is so in different states in each country. We are in different states. When Italy was in high stress, Spain was just beginning. When we were in this high stress, United States, it was just beginning. So it was so difficult to find ourselves in the same phase that, well, I decided to organize this content to try to offer a frame to understand the kind of intervention we, as Brainspotting practitioners, we can offer to our population. So if I gave you some good tips to just think on this and be prepared if things go worse, or you can have huge demand. I'm happy. So thank you to all of you to share, to use your time to be here with me and with these Slovenian organizers. Thank you, Sabina, Tamara, Jana, and Mina. I don't know if Mina is here or not, but thank you for organizing this.
Thank you, Mario, to you too. Maybe if you have another few minutes, we said that we will say a few words about trauma training. You will hold it in Slovenia. Do you have?
Yeah.
Yeah. So as we said, in October 2020, Brainspotting Slovenia will organize trauma training with Mario. And Alesseya trauma reprocessing method is the result of 30 years of therapeutic practice of Mario and Carmen Cuenca. This method involves integration of different approaches of psychotherapy, such as relational integrative psychotherapy, neuroscience, and current trauma mindfulness body-based approaches. And Mario, could you please share with us some words about trauma training?
Well, this trauma training is an integration, as you said, of 30 years of experience. We try to integrate the more up-to-date approaches on trauma. So we will cover the first year, which is 2 phases or 2 modules of I don't remember, 4 or 5 days each module. We will cover the topic from interpersonal to intrapersonal. So we begin with establishing and creating and working very relationally and creating this therapeutic relationship, but also using this way of working and creating the relationship to frame, to help the client frame on the issue, and also to develop the skills of the therapist on listening very selectively to the core material that is hidden in any trauma. So that's very important to also shape our state of presence. You know, then we go to other topics such as the neuroscience and neurobiology of trauma and strong dissociation and strong dissociation. How with a strong dissociation we split our sense of ego in ego states or parts, and how to work with the complexity. And we will cover in this first year also on working with resources and weakening the resources, and how we end with emphasizing again what I call the essential being, our state of presence. You know, this is for the first year, and I think for today is enough. So the important thing is that this is a mindfulness-based approach, as any up-to-date approach in trauma, and very focused on a process and listening to the body and working with the body and emotions.
Okay.
This is on October 1st to 4, 2020.
Yes, thank you, Mario. And if anyone want to have more information, please send us email.
Yes,
so
one more thing is that
yes,
we are prepared to offer this training also through video conference.
Okay.
So if people from abroad, Slovenia, want to attend, just write to, for example, to 10 or to me, because the international community probably I will handle directly. But we are thinking on this also. Okay.
Great.
Okay.
So thank you to all of you. Special thank you to you, Mario. You have you share with us very valuable knowledge today. I believe it was very helpful for all of us. And I wish also all to stay healthy and well.
Yes. Please stay healthy. We will have to do a lot in these next times. Yes. Thank you to you, and nice to know many of you for the first time.
Bye-bye to all of you.
You can open the micros and say goodbye if you want.